All right. Hello, everyone. Welcome to today's webinar. Today's topic is back health, specifically on helping prevent lower back pain. Before we get started, just a couple of the normal items to take care of. We will have time for questions at the end of the presentation, and you can type those into the question box in the lower portion of your control panel. We will be posting a recording of the webinar on our blog. The link for that will be shown at the end as well. And if you would like a PDF copy of the presentation, there will be a link to download that on that same post as the recording. If your question does not get answered today at the end, please email our support inbox, which again will be shown at the end as well. So for today, we'll be discussing back health, like I said, mostly focusing on what you can do to help prevent that low back pain that plagues so many of us as we get older. We'll go over some risk factors to keep in mind, and then what you can control to help prevent issues from arising. Now, one thing I do just want to be clear on before we start today is that the information that we share in the webinar is not meant to diagnose or treat existing conditions with your back. There are many different causes of back pain, so you need to be seen by your doctor to properly diagnose and set a treatment plan, as we don't want to cause further issues by doing certain stretches or exercises if there is something else like an underlying issue going on. Now, if your doctor gives the okay to do some of the tips I present today, then absolutely fantastic. But again, double check that before you do any of the specifically the exercise that I talk about today. All right, let's get started with some risk factors that we should keep in mind that can lead to back pain in the future, possibly. Now, some of these are things that we can change, some we cannot, but everything is just meant to keep you mindful of the factors that can lead to that back pain. First one is age. We are all getting older, unfortunately, and our body does change as we get older. Our intervertebral discs, which are basically shock absorbers for the spine, can begin to lose fluid and flexibility, which decrease their ability to cushion those vertebrae, which are the bones of our spine. We can also lose bone and muscle strength from just different activity levels. Typically, we're a little bit less active as we get older, things like that. So just being aware of our movements and different tips on the posture and activity that I'm going to share in the next section are very important, because age is something we can't control, right? But we can do things to help delay or even prevent some of those issues from coming around. So stick around to hear more. Next risk factor is going to be fitness level. This makes if we have weak back and abdominal muscles specifically from not being active, they're not going to support that spine as well, which can lead to back pain issues. One thing to keep in mind, according to the National Institute of Health, those that exercise a bunch, say, on the weekends after being completely sedentary during the week are actually more likely to have a back injury than those who do something consistently most days of the week. Now, this doesn't mean you have to go crazy and do a crazy workout every day, but getting out for a quick walk over lunch in the morning after work will help keep your body ready for those more intense workouts if you are just doing those on the weekends. Low-impact aerobic workouts like that walking are beneficial for helping keep those discs, like I just talked about, healthy. It helps them, keep that fluid in there, get some blood supply to them. So again, do what you can to do at least a little something daily, and I'll touch more on this in a little bit. Next risk factor to be mindful of is pregnancy. Most of us understand this. It's due to the weight gain, and it changes your center of gravity because all that weight is specifically in that stomach area. Our pelvic area changes as well too, and can shift those bones. All that good stuff that comes with pregnancy. Lower back pain is very common in pregnancy, but if you're careful and practice healthy habits, this pain almost always goes away after baby comes. So again, be mindful, talk to your doctor about different things you can do, and actually being healthy and have those good muscles before you get pregnant is very important. So if you're at that age thinking about it, make sure you're doing these healthy things that I talk about today. And that kind of goes along with the next risk factor, though, just weight gain in general, not necessarily due to pregnancy. When we gain weight, it puts more stress on all of our joints and bones and everything, right? And that back is not going to be any exception, especially if you're predisposed to gaining that weight in that belly area like some of us are. It's going to change that center of gravity, can shift that low back and put some more stress. So again, keeping a healthy weight is very important too. What you do for a living can lead to back pain as well. Jobs that require heavy lifting, pushing, pulling, twisting, even things like vibrating can lead to issues. But also, jobs that are sedentary can lead to the same thing due to poor posture or ergonomics when you're sitting. So we've got the opposite ends of the spectrum kind of here leading to the same result with that back pain. And again, I'm going to talk about proper form and posture here in a bit that will help you out no matter what profession you're doing, either active or not. Mental health is also a risk factor for back pain. Surprised? Definitely true there. And there are a couple of things at play. One is that anxiety or depression sometimes simply affects how much you pay attention to your pain or your perception of your pain. So you may be doing something to hurt yourself and not really even realize it, or maybe just not care at that point, unfortunately, if you're dealing with those concerns. Also, when we're stressed, it causes physical reactions like muscle tension, right? We've all felt that, which that can develop into pain as well if we keep our muscles tense. And that, again, the back is no exception. We can carry tension in all parts of our body. And this can go in reverse too. Those with chronic pain, like back pain, can develop mental health concerns as well. So again, it can go both ways, which is why doing something early on, if you either have physical pain or mental health concerns, is extremely important. Next risk factor is going to be smoking. Another one that might be surprising, but I've got a fact for you from the Cleveland Clinic. Smokers are nearly 3 times as likely to get lower back pain as non-smokers. And here's why. It impairs the delivery of oxygen-rich blood to bones and tissues. So decreasing this blood flow can cause degeneration or breakdown of those discs I already talked about a couple times. And these actually, the intervertebral discs also already have limited blood flow to begin with. So again, this is just going to make it worse and can cause pain and can even lead to things like osteoporosis. On top of this, smoking may actually increase pain sensitivity in general. So the pain you may already feel feels even worse. So if you need another reason to quit smoking, here you go, something really important to look at. And then that last risk factor for back pain is just genetics and underlying conditions. We know things like arthritis and other conditions can be passed on, and it can affect our back health. But again, if you know that you have those things in your family tree, that's even more reason to practice healthy habits before the symptoms show up, right? As again, you can at the very, very least delay some of those issues, sometimes prevent, but at the very least delay some of those issues that come along with those certain conditions. Okay, let's get to what you can control, what you can do to keep that back healthy and strong. So start with that posture. So the goal with posture is to keep those 3 curves in our back, or those natural curves, aligned. Not too little, not too much curve, so that our body weight is evenly distributed and our spine, hips, knees, ankles are all in balance. What this does is it prevents strains in muscles, ligaments, and joints, one of the top causes of that low back pain. So what should good posture look like? So when you're standing and seen from the side, your ear, top of your shoulder, your hip, your knee, and your ankle should line up in a straight line, like this picture right here. Have a friend or family member take your picture from the side and then see how you look so you can look at yourself. The American Physical Therapy Association has some ways to tell too. One is just to start by standing in front of a full-length mirror. Hold your head nice and straight with your ears level. Are your shoulders even? Are the spaces between your arms and sides equal? That's one that I never thought of until I did some research. Are your hips level? Both your kneecaps should point straight ahead. Your knees should be relaxed, not locked. If you lock your knees regularly when you're standing, you can actually hyperextend them, which means they just get hyperextended. That is kind of what it is. You extend them too far, which can actually lead to low back pain in itself. Now, your ankles should also be straight, not rolling in or out, which can lead to some misalignment. Again, it just goes up into the knees, hips, and back eventually. Now, if you do that and if you see anything that looks out of place, or again, when you're standing sideways and you don't see a straight line, or if there's any major things that look out of place, chatting with a physical therapist is a really, really good option to get some advice on how you can correct those concerns. Let's talk sitting next, because I know this is a big one for a lot of us, myself included. What does the correct sitting position look like to support that low back? If you're sitting right now, give it a try. So I want you to sit up tall with your shoulders back. Your tailbone, that rear end, should touch the back of your chair if you have the back of your chair, or it should be on the very back. All three of those normal curves of the back should be there. You can use a small towel actually rolled up right at that low back to help maintain that curve if you don't have a chair that already has those supports in there. Ideally, you'd have a chair that has those supports, but if not, again, you can use a roll-up towel, or there's different products out there that you can purchase to kind of support that curve and that low back specifically. Now, you want to make sure your weight is distributed evenly on your hips. You want to keep your knees at 90 degrees with your knees even, or even a little slightly higher than your hips, if possible, or if you're comfortable that way. Don't cross your legs. That's not going to keep your weight evenly distributed. Keep your feet flat on the floor, or if you're short like me, get a footrest so that your feet can be flat on that rest and then still maintain that 90 degrees at the knee. Keep your phone, your mouse, anything that you need regularly at your desk within arm's reach, so you don't have to stretch to grab it, because all of those stretching, all those turns can cause issues with that low back if we do them a lot of times throughout the day, which we do, right? If you have a twisting chair or a rolling chair, when you turn, don't twist at the waist. Turn your whole body. So you use your chair and twist the whole thing, your knees included. Try not to twist that upper body to reach for something. Again, if you've got things within reach, you shouldn't have to worry about that too much. And then you want to avoid sitting more than 30 minutes in the same position. So, either switch positions if you can. I mean, it's going to be hard because you want that proper position. Mainly just get up and do some movement or stretches for a minute or so before you sit back down. And on that note, if you find yourself looking down at your phone, your tablet, or if you've got handheld devices at any time, either at work or at home, be sure that you're taking a break from that position as frequently as you can. That's really the king of poor posture positions, right? We're looking straight down at our phone, and we don't even realize how much that can affect us because we do it a lot throughout the day. And keep that in mind for kids, too, if you've got some kids that have tablets and things. And then after you're sitting, one other thing to kind of keep in mind, when you go to stand up, move yourself to the front of your chair and stand up by just straightening your legs. If you're at the end of your chair, you should be able to just stand straight up instead of bending forward at the waist more. I mean, I know you're already kind of bent a little bit, but don't bend forward when you're getting up. That puts stress on our low back. Use your legs to do your movement, not your low back. How about sitting with driving? I know we've got a lot of people that are in those types of positions listening as well. Similar principles are going to apply. Keep that tailbone as close to the back of that seat as possible. Use that lumbar support either from your car seat or from a towel, or again, there's other things out there that can support that low back to keep that natural curve. Your knees, again, should be at the same level as your hips if possible. As a short person, again, myself, I know this can be hard depending on the type of vehicle, so just do the best that you can with this. And then find the happy medium with the distance away from the steering wheel. We don't want to sit too close because if we've got cars with airbags, which most of them have now, we don't want to be too close, right? But we also don't want to be reaching with our arms too much, as that can cause strain as well. So try to find that happy medium, like I said. All right, how about lifting, proper posture when lifting? Whether you have a job that requires you to lift things or you're simply doing some rearranging at home, we all have to lift things. And we've all probably been in a situation where we've lifted too much, right? Our egos got in the way of our common sense and we went a little overboard and maybe strained ourselves. So some things to think about beforehand so we don't find ourselves in that situation again. First, simply just stop and think about the load you need to lift. Is it too heavy? Should you ask for help if possible? Honestly, better safe than sorry when it comes to preventing back health. One thing that can affect a long time is lifting something too heavy, because you can tweak your back and you can always have issues from then on. So be really, really careful and be mindful, and grab a friend or family member if you need it. If you feel like you can't handle this load, first you want to be sure that your muscles are warmed up. couple minutes jumping jacks, jogging in place will get that blood flowing. It doesn't have to be anything crazy, but we do want to make sure we're not just all of a sudden jumping into that. Same thing as exercise, lifting is. So we want to make sure that our muscles are warmed up. Next tip, you want to stand close to that load that you're lifting. You put a lot more force on your back the further away you are from that load. So get as close as you can. You see this guy has his right in front of his knees. Even if you're able to put it between your legs to lift that way too. However, you can get as close to your body, close to that center of gravity as you can. And then next, you want to bend mostly at your knees, not just at the waist. Again, you're going to bend a little bit at the waist, but you really want to go down and do a nice squat because that's what you're going to use to lift is your legs, not your back. And then on a side note, be sure that you have a good grip as well. If there isn't a good way to get a handle on the package, consider asking for help. Just because it's not necessarily heavy, sometimes just those awkwardly shaped loads can do just as much damage because, again, you're twisting or you're lifting or you have to reach far away to get that. So we need to be really mindful of just the shape as well. And then, again, lift with your legs, not with your back. That's why we do that squatting position. Put that rear end back, get into a nice squat so you can use your legs. That's a big one where I think where people get into trouble, right? We don't pay attention. We just bend over to grab it and pick up. And then once you have lifted whatever it is, try to avoid twisting it while you carry it or wherever you need to put it. Try to avoid where you're twisting that upper body. And then another really important one, lower the load the same way that you lifted it with that proper technique. This one is just as big, I think, as someone not using your legs. When we go down, we just want to put it down, right? Especially if it's heavy. So we just kind of drop it down and we let our back and our upper body just go down with it. That is the opposite of what you want to do. If you bend at the waist and don't have that proper technique, you will do just as much damage as when you're trying to lift it. So be really mindful of that. And these principles apply whether you're lifting boxes, whether you're actually lifting weights, whether you're lifting your kids, squirmy kids, that type of thing too. So any type of load needs proper posture. So just always be mindful to help prevent back issues with all those things that we're lifting. All right, next thing, sleeping. This is one we may not think of as much, but we surely need good posture for back health when we're sleeping as well. And I can tell you this cute cat is going to have some back problems when he's older if he keeps sleeping all twisted up like that, right? I know he's cute, but that's not proper position. So anyways, depending on your sleep position that you prefer, Mayo Clinic has some recommendations on how to position yourself. So if you're a side sleeper, you should draw your knees up slightly towards your chest and then put a pillow between your legs to keep those hips even. If you're a back sleeper, putting a pillow under your knees will help keep that natural curve of the spine. Also, a small rolled towel under that low back will also provide some support. And then make sure your pillow supports your head and keeps your neck in line. That's the same with the side sleeping too. I didn't mention that. Make sure you have a pillow that keeps that neck and back in line, keeps that spine in line. If you're a stomach sleeper, which can actually be very hard on your back, and it's actually not recommended because of the position it puts on your neck, which can strain the rest of your body, including your back. But if this is your preferred position, if this is the only way you can sleep, the recommendation is to put a pillow under your pelvis and then your lower abdomen, so that lower stomach. Also, if your pillow raises your head too much and your back isn't in line, if you can feel that a little bit, they actually recommend not using a pillow to see if that helps keep that neck and back and everything in line. All right, on to footwear. All right, those of you who love a good heel, please don't be mad at me, but as you probably already know, they're not recommended when we are talking about back health specifically. And this is just because they cause an unstable posture. You're not even typically, which increases pressure on that lower spine and the lower back. If you feel like you do have to wear heels and it's something that you really enjoy doing, a couple tips: just limit your overall time walking in them. Go for a thicker heel if you can to provide more stabilization, and then a soft insole if you can on your feet. All right, I'm going to make another group mad, my flip floppers out there. Again, you probably already are aware of this, but these do not provide adequate support, which can cause strains as well. We really want something that has got arch support. So there's a lot of shoes out there that really are not recommended for back health specifically. So just be mindful of that. You know, especially if you have a job that you're on your feet a lot, that's specifically the most important thing that you have to be mindful of to get supportive shoes. You should really talk to someone at a good quality shoe store and see what they recommend based on your line of work or what your activity level is. They're going to know the best, but again, you need something with arch supports, and different people's bodies are a little bit different. So find an expert that can help you pick out some good shoes, because that can really, really save your back. And then keep in mind, if you're a runner or with any exercise, that those running shoes typically start to lose their support around 400 miles as well. So again, I know you're not going to necessarily track every mile that you do, but just keep track the best that you can of how long you've had them. If you're a big runner, it might be 6 months or less. If you're normal, maybe a year. Maybe you use that as a time frame as well. But just make sure you're replacing them in a decent amount of time. All right, moving on to food and your back. Food, yep. So what you can eat can affect your back health as well. If you listen to some of our other webinars on nutrition, you may have heard about foods that cause inflammation in our bodies. So inflammation in our bodies can lead to pain, including pain in our spines, which can lead to back pain, right? The foods that typically cause inflammation in our bodies include things like sugar or refined carbohydrates, so things like white bread, pastas, rice, and then fried foods, alcohol. Those are the types of things that you should look to cut down on to lower the inflammation in our bodies, and of all the other health benefits, why we want to lower those. And then foods to get more of that actually can fight inflammation in our bodies include green leafy veggies, fatty fish like salmon and tuna, things like berries, olive oil, nuts, and seeds. Now, again, this is certainly not everything on either list, but these are just the types of foods that can actually help or hurt some of that back pain and can help prevent it in the future. So nutrition is always a part of everything that we do, and this is no exception. All right, last topic here, exercise. Now, again, the information today is more on preventing back pain than treating it. So just be careful on doing any exercise. Chat with your doctor before you make any major changes to your routine. But the benefits of exercise, and I've already mentioned it once, in preventing that back pain are huge. It strengthens those muscles that support the back, which can remove pressure from that spine. It helps us with range of motion, mobility in the back. It improves circulation to our bodies, including those spinal discs that already, like I said, have reduced blood flow to begin with. It helps increase that blood flow to those times, keeping those things healthier and keeping that support on your back as long as you can. Now, a well-rounded exercise routine is really the key to back health and health in general, as we know. So we want those three parts. We want our aerobic exercise to get that heart rate up. Recommendation, 150 minutes per week of moderate activity so that you can feel that heart rate up. Walking, swimming, and cycling are good options that are pretty easy on that back. I already mentioned how walking can benefit back health. So again, getting that in most days is fantastic. And then we want to include strength training to keep those muscles strong, to support that spine. There are a lot of ways to strengthen the back and the stomach muscles, or those core muscles specifically, which is what really support that spine. So the key is finding something you enjoy. Pilates, yoga, weightlifting, resistance bands, if you're not into free weights, those types of things are all good options. Again, not the only options, but some options. 2 to 3 days a week is a good amount to shoot for that strength training specifically, and that's on top of the cardio that we're already doing. And then stretching to help flexibility and range of motion, and really, really is one of the most underused exercises out there. Stretching your entire body is important, but one to note for back health is going to be stretching your hamstrings, which backs of those thighs, if you're not familiar, back of your upper legs. Now, tight hamstrings are a very, very, very common cause of lower back pain if you weren't aware of that. So just be sure you include that in your stretching routine, or create that routine if you haven't started it already. Now, I wanted to give you some specific exercise to look at and different stretches to do. Now, this is from the Mayo Clinic. So, again, this isn't everything that you can do, but I just wanted to include some samples so you guys are aware of things that you can do. I will put the link to this blog or to this Mayo Clinic article on the blog post with the recording, but just an overview of some things to do. Need a chest stretch. Again, you see here, you just simply lie on your back, pull those knees into your chest one at a time, and then do it both at a time. Keep those abs, those stomach muscles nice and tight. Keep your spine pressed to the floor during this. You want to do all of these 2 to 3 times each if you can. And if you can, do it once in the morning and once at night. That would be ideal, again, but you can work up to that. And then we've just got a lower back rotational stretch. We just rotate those knees to one side while keeping those shoulders on the floor. You may find that you can't go all the way with some of these stretches, which is perfectly fine. Just go until you feel that stretch. Don't feel pain, just feel that stretch, and then work on increasing that range each time. A few more here. Lower back flexibility exercise. This one, you're just in that same position for the others. First, I just want you to simply tighten your abs and hold it for 5 seconds. You might find that spine coming a little bit off the floor, and that's okay. Then I want you to relax. And then you tighten your abs again, but you pull your belly button down towards the floor this time. So push that spine into the floor. Keep that back flat on the floor and hold that for 5 seconds. Now, you can start with about 5 repetitions of each. Ideally, the recommendation is to work up to about 30 times each way for that lower back flexibility exercise. Next is just a simple bridge. Again, same starting position, feet flat on the floor. Tighten those abs and also your glutes, that rear end, and then lift your hips. The goal is to get a straight line from your knee to your shoulder. Again, you might not be able to do it right away. The goal would be to hold this for 3 deep breaths. So you want to shoot for 5 to begin with. But again, the goal will be to work up to 30 a couple times a day if possible. Again, I know it's not realistic for everyone to do that, but that's why we're working on it, to strengthen those muscles to eventually be able to do that many. All right, last ones here, cat stretch. Hands on your knees, or hands on your hands and knees for this one. You can grab a towel or something if you've got knee concerns to give a little padding there. So this one, you just start by arching your back up, and like you're pushing your abs and your spine up towards the ceiling. You've seen cat stretch, right? That's where this name came from. That's what we want it to look like. And then hold this for a couple seconds. And then when you come back down, just let your belly button sag down towards the ground, getting a nice stretch the other way. So again, 3 to 5 times, ideally twice a day for this one. Get those nice stretches. And then the next one is similar to that one that we laid down to do a rotational stretch, but this one's up in your seat. So you can do this one at your desk if you want to throughout the day. Cross your right leg over your left. Put that left elbow on the outside of your right knee. Get that nice stretch to the side. Hold for 10 seconds, then do the other side. This last one is probably my favorite, probably because I'm known to have poor posture sometimes. It's just a shoulder blade squeeze. So you sit up with good posture, pull your shoulder blades together and hold that for 5 seconds. Act like you're trying to hold a pencil between those upper back muscles. Again, 3 to 5 times twice a day for these last ones. All right, so those are some just examples of exercises and stretches. Again, finding what you like to do, getting started, or adding in some extra moves to your current routine for that back health is super important, and your back will certainly thank you. All right, we got a couple minutes here left for questions, but just to recap really quickly, things to be mindful of for that back health. Posture, when you're standing, when you're sitting, when you're sleeping, when you're lifting. Proper shoes, especially if you stand a lot throughout the day. Proper nutrition, really watch those foods that cause inflammation and really get more of those foods that can help fight inflammation. And then just get in that regular exercise. Again, if it's simply just some of these exercises, that's just fine. Just getting something started to strengthen up those muscles is going to be huge. So before we get to questions, just some of those upcoming webinars. Next month, we've got some healthy substitutions that Coach Steph will be doing next month. And then in November, family wellness, tips for the whole family. We'll get you some good tips on things to do for everybody, from babies to adults. And then here's our contact information. We're on Twitter, we're on Facebook, we're on Instagram, all that good stuff. That blog, that's where you're going to find the recording of the webinars, including this one. And then download the app from your app store. A lot of you might be going through screenings and doing your surveys right now. Just keep in mind that it's a lot easier if you just have that app, and then you have the results right there too once you take that screening. So look for my Healthcheck360 on the app. And then you can give us a call if you want to chat in person. You can call or you can email, and we can set up a time to talk as well. And then if you do have some lifestyle rewards questions, I'll keep these up for now. But if you have those, you can go and submit those online. Again, not every company does it, but if yours does, these are the ones you're going to want to answer for today and this month.